This segment of Delmarva Life is brought to you by TidalHealth.
5 pounds here, another 2 pounds there. Your doctor tells you to watch your weight. The next visit, you're up 20 pounds. Before you know it, the doctor writes the word obese on your medical records.
If only losing weight was as easy as gaining it. But when you do get to a certain point, it's not only a matter of how you look and how you feel about yourself, it may become a life-limiting issue. It also may be a time to consider weight loss surgery. Dr. Reshmi Udesh is a general surgeon specializing in bariatric surgery at TidalHealth, and she joins us this afternoon. Thank you so much for being here.
Thank you for having me.
So we talk about it all the time. It's an epidemic, obesity. Obesity can cause other conditions, can it?
That's right. Yep.
Tell us.
Yep. It can cause a host of other health conditions like high blood pressure, diabetes. Some people even get severe arthritis that makes them even bedbound, unable to get out of bed. They can get sleep apnea, just to name a few. Some people also get an increased risk of cancer, which can limit their overall life expectancy. Yeah.
So there's medical and there's surgical weight loss.
That's right.
How does someone know if they qualify for medical or surgical?
That's right. So for bariatric surgery, there are specific criteria that we expect our patients to be at to qualify. So it's based on body mass index, or what we call BMI. It's the patient's weight based on their height. They need to be a BMI of at least 40 or a BMI of 35 with other major health problems like diabetes or high blood pressure and so on. So when patients call our office, we invite them for a free bariatric seminar where we discuss the different medical options and the surgical options that are available at TidalHealth. And we let the patients decide what they are interested in and what would suit them best. So at the end of the seminar, if they're interested and if there's a specific path that they want to follow, we schedule an appointment with either a medical weight loss provider or with a surgical provider.
All right, so bariatric surgery, you decide on getting it. What does pre and post-operative care look like?
Yeah, so once a patient decides that they want surgery and they meet the criteria, the process that readies them for surgery takes about 3 to 6 months. So they do have to meet our dietitian or the nutritionist several times to prepare for dietary changes that come with undergoing bariatric surgery. They also have to see a mental health professional to make sure they don't have any mental health issues that may prevent them from succeeding with the surgery. So once we feel like they're ready for surgery, like I said, it can take 3 to 6 months. We do the operation, and they usually stay in the hospital for about 1 to 2 days.
Okay, so your patient has had surgery. What are reasonable expectations afterwards?
Right. So surgery is often the first step, which is what a lot of patients don't understand. It's just one piece of the puzzle. And more than 90% of patients lose half of their excess body weight within the first 1 to 2 years of surgery.
Wow.
Say if they're 100 pounds overweight, they lose about 50 pounds within the first 1 or 2 years. But like I said, surgery is just one piece. We also encourage them to complement the weight loss that they get from surgery with diet and exercise, and often it's a lifelong commitment. And we expect the patients to use this for any guidance they need in regards to what they can and can't eat, what exercise works for them. Walking works great for most people, and what supplements they need to take, because they can have vitamin deficiencies from the surgery, and we do test their blood levels at regular intervals to make sure they're headed in the right direction recovery-wise.
So what other support does TidalHealth offer after the surgery?
Right. So our whole team comprises of several different components. Like we have a medical weight loss expert. We also have nutritionists and several nurses who keep track of the patient's blood levels and their different exercise levels, how much weight they've lost, and so on. We make individual recommendations to the patients based on what their problems are.
Okay, so somebody's interested in everything that you've just said, and they want to find out more about bariatric surgery. Can they come straight to your office? Do they need to be referred by their physician?
So they can either call our office directly if they have any questions or if they're interested in attending a seminar, or they can talk to their primary care doctor who can give a referral to us.
All right, and we'll have your office information on our website, delmarvalife.com. Dr. Udesh, thank you so much.
Thank you for having me.
Enlightening us.